Okay, thank you. Bear with us. We promise you more information. First of all, can we give Joan a hand? I mean, she always makes me feel good about the work, but makes me feel like there's so much more to do. So hope you got that sense as well. We're excited about this panel as well. So one of the things we were worried about is that if you live in the child care world, you know child care. You live in the Head Start world, you know Head Start. And we wanted a chance for you to understand those programs and then merge a conversation. Again, we'll be asking you to ask them questions as well. And we're real lucky to have with us Hannah Matthews. She's the Director of Child Care and Early Education Team at CLASP. She has expertise in the areas of child care subsidies, cultural competency, infants and toddlers, and early child care systems. So we're real excited to have her. We also have with us, we're really lucky to have Yvette because she can talk to us now because she's been away long enough. Yvette Sanchez Fuentes, who's currently serves as the president of the National Alliance for Hispanic Families, but a lot of us know her from her role at ACF around Head Start. And so we've got real expertise in having her with us. And then we also have Yasmina, who's worked both on the child care side and on Head Start, but is currently the executive director of the National Head Start Association. And so she's going to come and give us the goals, and then we're going to launch into some presentations from Hannah and then Yvette. Yasmina?
Hello, everybody. So, Joan's talk about the families getting married, I felt really like I'm here at the wedding too. Just given my long history with both childcare and Head Start, it's really my great pleasure to be here, and I thank Sherri and Susan for including me. And as Joan said, this is truly a great opportunity that we really need to make the most of. Because we do. Head Start and childcare, we share a commitment to the nation's children and families, to child development and to early learning. Understandably though, given respective legacies, and Sherri sort of touched on that, there are also differences. Childcare came into being to enable parents to work and to promote the health and development of children. Head Start was, on the other hand, intentionally and thoughtfully designed to prepare children from low-income families for school by enhancing cognitive, social, and emotional development of the children and by promoting the well-being of the family. So both are essential missions, but naturally they resulted in different practices, and you've heard quite a bit of that so far. Thanks to the administration and Congress, we now have a chance through these new partnership grants to successfully align the two systems at the local, state, and federal level. And because of those different histories and missions, the alignment will look different at each level. I chose to join NHSA in 2009 because I knew, based on my work with the Obama policy teams, I was both on the children and families and education policy teams, that this president was and is committed to progress on behalf of children, families, and education. And it was clear to me then that Head Start, as the original intentionally designed system, could be at the center of that nexus and of that progress, but it would need to evolve, and I'm just really proud of the change that our board, our team, and our Head Start community have been able to achieve in 5 short years. And it's been hard work for us and for our community. We took some body blows in the process. There was this thing called the impact study, which mischaracterized Head Start. There was recompetition, there still is recompetition, sometimes for small and bizarre items. And then the sequester cuts. The good news is we survived, rebuilding trust, reframing our mission, and ultimately crafting a new vision. And we're not done yet. In fact, these partnership grants are our next big test. Can we coalesce, inspire, and support the Head Start field to make the most of this significant opportunity for infants and toddlers? I believe we can, because we're not your mother's National Head Start Association, and we're not your father's Head Start anymore. Collectively, we, and that's our programs, our state associations and NHSA, we're ready, willing, and able to partner with childcare providers at the local level to provide high-quality services, partner with states to build early learning systems, and with policymakers at the national level to sustain this opportunity. All this so that more babies and toddlers can have high-quality experiences. So given the thrust of the meeting, I want to take just a moment to discuss the systems building. I started as a child care center director, managed a federal grant program in a state, headed New Jersey's Governor's Task Force on Employer-Supported Child Care, implemented the CCDBG first time it came around in 1990-91 for New Jersey, all before becoming NACRA's first executive director and then advocating for the last CCDBG reauthorization in 1996. Finally, before coming to NHSA, consulting with states on QRIS, workforce, and so on. So you cannot have done all that and not really care about state systems. I also have a deep personal engagement in the issue of what's the ultimate outcome, and that's that ever since my children were really tiny, I was just haunted by the inequities and unfairnesses in access to quality for all children. So this is really important because both Head Start and child care are national commitments that are intended to mitigate that unfairness, and they really have the potential to do that. And so meetings like this is sort of how do we make sure that that potential is fully employed. And some of you may not know this, but Head Start is already a core piece of the early childhood system in many states. Despite, or maybe because of our history of federal to local funding and accountability, we do believe in systems. By and large, we're not siloed in our program vision or perspective. In fact, we're a community hub committed to partnering to meet the needs of our low-income families. So Head Start and Early Head Start program have almost 50 years experience in partnering with school systems, state agencies, faith communities, local businesses, and most especially partnering with families. Our local program planning and development is based on a community needs assessment, but when surveyed, more than half of our state associations reported receiving state funding, which is further indication of the reality of strong, stable Head Start and state-level relationships. And now in the fast-moving world of state-based early learning, we recognize the critical need to have accurate and accessible data about enrollments, numbers of eligible children, and other key data elements. Some other opportunities to partner with states that we would welcome include active and effective state advisory councils, and child assessment, family engagement, professional development, workforce initiatives. Finally, let me just reinforce what an important opportunity this is. We at NHSA, we recognize these partnerships as a flashpoint from the moment that Roberto Rodriguez of the Domestic Policy Council at the White House briefed me on the White House proposal to expand the model following the President's 2013 State of the Union. And I recognize what a great chance it was for progress in serving more children with high-quality early learning experience, and it did not take much for him to convince me that Head Start had to ensure that the investment actually succeeded. I was persuaded immediately and continue to be committed to the idea. We were then joined sort of with that knowledge that this was going to happen and that this was the part of the vision. We were joined by great partner, Rick Mockler of the California Head Start Association, and Pam Shaw, who is here. We're fortunate to have her here, who is the president of the association. And we began talking to anyone who would listen about how to make those partnerships on the ground successful. We convened providers across the spectrum of childcare, both for-profit, nonprofit, family childcare homes, center-based, Child Care Resource and Referral, and Head Start to build on-the-ground bridges. Because we had sort of figured out that the first order of business was culture change. We've been more vocal the last few months, but our perspective is informed by almost 15 months of that background work at the local and national level. And now connecting all this effort to state systems work makes absolutely infinite sense to me. And I'm grateful to Build and its funders, Buffett, Kellogg, Gates, Packard, and the Harris and McCormick Foundations, for progressing the conversation to the state level. Next month, we'll be putting the next building block in play and convening national thought leaders, advocates, and policymakers to discuss best practices as part of a strategy to sustain this funding opportunity beyond this Congress and this administration. And I hope many of you will be able to join us for that conversation too. Thank you.
I'll assume they're pulling up the slides any minute. Okay. Hi, everybody. It is great to be here. I am excited to have the role of talking about childcare today, although as if it's bad enough to not have this panel follow Joan, now I get the job of telling you about federal rules and regulations, so that's really unfair, because we're about to get very in the weeds here. So my task is to, I'll just start talking and the slides will catch up. My task is to give a very high-level overview of CCDF, and I'm going to do this, as I said, by laying out the federal rules and focusing on some key areas where states have enormous flexibility and can consider some options where they may look to align policies with Early Head Start. I want to say at the outset what I'm not going to talk about, because certainly there's not enough time to talk about everything related to childcare or even related to CCDF that are relevant for partnerships, so I'm going to focus on the subsidy policies in particular, and I'm not going to talk about childcare licensing standards and ratios and group size and QRS standards and all the other pieces that we want to think about as we think about the alignment in the early childhood system. Let's see. But I only have 20 minutes, so the Child Care and Development Fund. I know there are a lot of people in this room, and so my job here is to get everyone on the same page. So for those of you that are very familiar with childcare subsidies, please forgive me while I start with the basics. CCDF is the primary source of federal funding for childcare assistance for low-income working families, and also of funds to improve the quality of childcare for all children. If there's one thing to take away from the presentation, it's that states have enormous flexibility in setting policies as well as the processes around the provision of child care subsidies. The federal government sets rules within very broad parameters, and then states make individual policy decisions that impact access, that impact quality, and that impact the supply of childcare. So they decide who to serve, what rates to pay providers, who gets help, what costs parents pay, a whole range of decisions. And that's important for a couple of reasons. The first is that means that your state is very different from the state that you may be either sharing a table with or sitting next to. So you really have to understand how this plays out in your state, and in most cases, really at the local level as well. But it also means that there's lots of opportunity here to think about that vision that you want for childcare and that you want for those children in the subsidy system, and find a way to make those changes in subsidy policy. Before we get into the policy details, I think it's important to take stock of the current status of the program in terms of where we are. The Child Care and Development Block Grant, it's often used synonymously with CCDF, but it refers to the legislation that authorizes a portion of child care funding. CCDBG was last reauthorized in 1996. We, of course, know a lot more about the importance of quality child care, the role that child care assistance plays in families' lives, and how to help families keep child care than we did then. With that in mind, the Office of Child Care released new proposed regulations in June of last year. Many of your states have used those proposed changes already to really galvanize support for key improvements in policy, and that's been really exciting. We expect that that final rule will come out this summer, and of course we don't know the final details of what's in it compared to the draft that we've seen. But to add just a bit of complication and excitement to this, after several years of discussions and actions, the Senate overwhelmingly passed a bipartisan reauthorization of CCDBG last month. The action now has moved to the House, where a hearing was held last month, and members are said to be working on a bill. So whether the House can pass a bipartisan bill and whether or not the two chambers will come to agreement is a very open question. I would say the road ahead is very uncertain, and that makes this challenging to think about subsidy changes. On the other hand, while we don't know exactly what's coming and the vehicle through which it's coming, whether it will be new rules or whether it will be a reauthorization, there is a lot of overlap between the proposed regs and the Senate bill. So I think one way or another, there are a number of changes coming to CCDBG that I know you all will be ready for and embracing. So just to start with the goals here, and this is based on current law, CCDF goals emphasize flexibility for states, parental choice, consumer education, independence from public assistance, and state regulation of health, safety, and licensing standards. So very different from other early childhood programs that may have an exclusive focus on child development. And there is absolutely broad interest at all levels to revise these goals and have a greater focus on quality and on, for young children, a focus on school readiness and also thinking in a more systemic version. And of course, those are threads that we see both in the regulation and in the proposed rules. But I think, we have to note here the important role that CCDF plays in terms of helping parents with child care costs, because that's very unique in this program, and parents going to work is also really good for young children, and so we have to think about how the program is able to meet the dual needs of both parental employment and the needs of children. So I'm sure the people in the back room cannot read this slide, and that's okay because you'll get handouts, and it's actually not so important what's on here, but to know that it only takes 2 slides to actually list all of the federal requirements for CCDF. There are not many. So I'm not going to go through them in great detail. I want to point out some key areas. I'll go down the list just so you all can see what's on there. But states are required to submit a biennial plan. That's a process that is an opportunity to give input on proposed changes at the state level. So that's something to know about. States must provide consumer education to families. How a state does that, what they provide, and the intensity of that education varies widely. States must have basic health and safety requirements. They have the option of exempting providers from meeting those standards as well. States must allow for parent choice of any legally operating provider, and including those who are legally exempt from licensing. And children are in providers in all of those settings in the subsidy system. States establish licensing and monitoring policies and decide who's exempt from licensing. So who is required to be licensed in your state, again, is going to be very different from the folks sitting next to you at the table. They also decide how frequently, or if ever, they visit any of these providers, and again, that varies dramatically. States must conduct market rate surveys of child care costs at least every 2 years. That identifies the price that's being charged for child care in a community. Note that states do not have to use this survey in actually setting their payment rates. There is a provision that requires states to set provider payment rates at levels that allow CCDF eligible children to have equal access to the other child care options that non-CCDF children have. I think the reality is when we look at the rates, they are extremely low. Only 3 states now pay what is recommended in federal guidance, not required, but recommended. And so this particular provision is rather hard to enforce. States make trade-offs in context of CCDF, and rates in particular have taken a significant toll in recent years, and I'm going to talk a little bit more about that. States are required to have a sliding fee scale for parent fees. Parents must contribute to child care costs, and this fee can be waived for some families. And finally, states must spend 4% of their funds on quality initiatives. These quality dollars support a range of different these are in addition to the targeted funds, for infant and toddler quality as well. They support activities from basic monitoring, on-site inspections, QRIS, scholarship programs, and they are intended to improve the quality of all child care. So that's also something very unique about CCDBG, that while the access to child care is for low-income families, really these quality dollars are supporting, as you all know, the foundation of a lot of the early childhood system's work. So the federal rules establish broad eligibility criteria in which states set specific policies, and there are only 4 of them. Children are between the ages of birth to 13, in some cases up to 19 for specific special needs. Children must have parents who are working in education or training, or they're in a protective services category, and each one of these categories is defined by the state. And we'll talk a little more about that. Family income must be below 85% of SMI, that's the state median income. It's roughly, but not perfectly, close to about 200% of federal poverty. And within that, states, although that varies, again, widely from state to state, states must prioritize very low-income children and children with special needs. They also may have additional priority populations. Children also must be qualified immigrants or citizens. Note that it's only the child's status that can be considered and not the parents, and we'll talk a little bit more about that as well. So that's the federal criteria, but who really gets help, again, is based on state policies that are often set much more far below kind of the federal guidelines, because states make restrictions based on not having enough resources to meet the need. So even though income eligibility could be much higher, in reality, over half of the families who are in CCDF have incomes that are below the federal poverty threshold. And of course, that's one of the reasons why the partnerships here are so important, because we have a set of children who are in CCDF who are very likely not getting the full access to comprehensive services that kids who look very much like them and their household circumstance that are in Early Head Start. In terms of infants and toddlers, about 28% of children in CCDF are under the age of 3. That's roughly about 420,000 infants and toddlers. It's nearly 3 times the numbers of babies and toddlers in Early Head Start, so childcare really does have the children, as Joan said. And again, it varies dramatically here by state. So when we can look at the range from about 18% in California to babies and toddlers making up nearly half of the child care families in DC. So again, you really want to look at your state data and know who the families are that you're serving. Most infants and toddlers in CCDF are served in centers, and more than a quarter are in family homes. And that looks a bit different than the settings that we think of infants and toddlers in when they are outside of the subsidy system. So we know that families who are getting subsidies are more likely to be in centers than those without. And I mentioned here the income level of CCDF recipients. Over half of them overall are under federal poverty. For infants and toddlers, they're even more likely at 64%. And the average monthly CCDF payment rate for infants and toddlers is just over $5,500 when annualized, and that is significantly lower than any comparison we would make, whether it's what we provide for kids in Early Head Start, whether it's what we know of as the cost of quality. It's very, very low. So states have enormous flexibility here, and they make decisions that impact access and continuity for children and families, and those are the pieces that I'm going to particularly focus in on today. So states define work, education, and training. They decide what activities qualify. That's a state decision. States, as I said, set the income eligibility and prioritize groups. States decide how eligibility is determined. And in many states, this process is very complex and very burdensome, full of onerous documentation requirements that really make it difficult to not just get a subsidy, but to keep a subsidy. And all of those requirements, every paperwork requirement, is entirely governed by state policy. So there's a lot of room to simplify the system with the goal of keeping families in it. States also set how care is authorized, so they decide whether there's a minimum number of hours. They decide whether they give part-day rates or full-day rates. They decide whether they pay for absent days. All of these which affect, again, not just a family's access to care, but really are about supporting the provider as well and making them able to provide quality care for infants and toddlers in the program. As I said, states set provider payment rates. They are extremely low, and we'll talk more about that. And I want to mention here, too, that it's really important to recognize that states determine both the policies and the processes. In a lot of the work that we've done in states over the last couple of years, it's clear that processes can be just as important, or if not more, than the actual policy is on paper. And so we really have to look at how the program plays out very often at the local level. If families have to show a work schedule for a child care authorization, and that work schedule changes every 2 hours, or perhaps a day or two beforehand, which is increasingly common in low-wage work, then having a parent eligible for childcare doesn't mean that much, because that mom's not able to keep the subsidy if she continually has to keep going back and having her authorization changed. So we really have to think about how the whole system works from the policy to the actual process. So I want to highlight some key differences here from Early Head Start, and also some opportunities for state policy change. And it's just a few, because I, again, can't get them in, all of them in. So CCDF supports parental employment, right? So the inherent problem in that is that low-wage work itself is inherently unstable. So when we think of getting kids continuous access to childcare, and think about childcare assistance being a stabilizing factor for both the families keeping jobs and also for kids in care, we have to make sure they can keep that subsidy through those ins and outs of jobs that happen in low-wage work. So states can establish, and many are, looking at broad definitions of work that include job search and other areas to allow for temporary gaps in employment, and to think about more continuous eligibility to reduce some of that instability in families' lives. There is also no requirement to match work hours or work schedules to childcare, so states can support broader authorizations that aren't limited to the particular hours that a parent may be working. Childcare subsidies, on average, families have them for about 3 to 7 months. And so you hear a lot about states talking about longer eligibility periods, annual authorizations. You can actually link the authorization to the Early Head Start eligibility period, But what's important here is limited interim reporting, because if you have 12-month authorizations and 12-month eligibility, but again, the mom has to report every time there's a change in her work status or her work hours, that 12 months in reality ends up being far, far less. So thinking about all of the different ways that families get bumped out of the system and how we can keep it smoother and keep them in are the areas that states can do a lot of work. Most childcare subsidies are paid through vouchers, so families get a certificate and can take it to any provider they want. Only about 10 states now use direct contracts with childcare providers for a very small share of children in the subsidy system. But those direct contracts have enormous potential to both link to quality standards and not just benefit children, but have a more stabilizing source of revenue for providers. So treating childcare more like a program where we contract with a provider in the way that Early Head Start does, rather than a certificate program. Childcare subsidies also, as I said, have a parent copayment. So, and this can be particularly burdensome for low-income families, even when they're getting help. We know how expensive childcare is, and how low the incomes are of families in the program. States have to have a sliding fee scale, but they may waive copayments for families under poverty, and so that aligns with those who are eligible for Early Head Start. I mentioned that CCDF has immigration restrictions for children. It's really important to know that those verification requirements do not apply to children who are in childcare that's subject to Head Start standards, or who are also receiving Head Start funds. So as we think about children in partnerships who are being served by Head Start dollars, we have to be very aware of not needing to have unnecessary restrictions and verifications. So payment rates, I think, are by far the real challenge right now. And we recognize that it is resources that have kept rates low in many, many states. But when we think about the quality of care, we just cannot be paying providers at rates that are just years and years and years out of date. States can pay rates that support higher quality care, although most that do have higher rates that are linked to higher quality still don't come anywhere close to the rates that are recommended in federal guidance. In addition to thinking about the rate, states can also think about the payment methods that support providers. And this is really, again, important to think about the stability for providers in the system. So paying for enrollment versus attendance, covering absent days. For those of us that have had infants and toddlers in childcare and pay through the private market, you pay for a lot of days when your child is not in care. But the provider still has to pay the teacher that comes to work in that classroom every day. So thinking about those payment methods as well as timely payments, making sure that providers are getting paid. Most childcare is paid in the private market, again, a month in advance, not reimbursed afterwards. So all of this is very different in the subsidy system. And then some states put restrictions on CCDF dollars. So states can allow providers to layer funding without restricting childcare funds, so that the Head Start funds may pay for a comprehensive service for additional part, childcare subsidies pay for another, but we have to really make sure that providers are getting that full day subsidy, without which the partnerships become very, very difficult because that funding source is not there. I want to make one more comment before I close, and that's just particularly to the childcare subsidy administrators in the room, is that we recognize that these decisions are constrained by resources, and childcare is in a really difficult place right now in terms of funding. We've, from analysis at CLASP, we've looked at the total spending from both the childcare and development funds as well as the TANF funds that are used for childcare, and state spending is at a 10-year low. We've also lost 260,000 children from the system since 2006, and that number continues to fall. So while many of these policy changes do take resources, and those are hard conversations to have. I think we need to acknowledge that they're costly. I think it's also worth saying that in many cases what we found is that some of those very resource constraints, and particularly the reduced administrative capacity in states and in county governments and in local offices, really make some of this work appealing. When you make a family submit 5 different pieces of papers, and 5 different people in the office have to check it off and have to verify and have to do work with it, there's a lot of cost and a lot of inefficiency there. So there are a number of changes that help families, keep families in the program, but also take some of the burden off administering agencies that can make the simplification, the making fewer documentation requirements, looking at data on families that's already in the system, incomes from other work support benefits that those families are getting. Doing all of that can actually help even with a situation with constrained resources. So, thanks.
Okay. Hi, everybody. You're still awake? You right? Okay, good. All right, I'm just going to go ahead and get to this, and I just very quickly want to ditto what Hannah said. So coming after Joan, having to talk about regs and rules is not that exciting, but we'll do our best. So like Hannah, let me just say that I am not going to talk about designation renewal, which is recompetition, because the purpose for today is really to give you as much information as I can about early Head Start so that you can go forward with your partners and design a quality, comprehensive, community-based program, okay? The other piece I also just want you to keep in mind as we think about, as you sort of take in all of this information, is that while there are limited waivers or limited waiver ability in Early Head Start, remember, Early Head Start is a community-based program, and it's up to grantees and their partners to design a program that meets the needs of those families in those communities. So keep those pieces in mind as we move forward. So just very quickly, the purpose of Head Start and Early Head Start is to promote children's growth through the provision of comprehensive services. For Early Head Start, there's one slight shift, and that is that those are family-centered services. Joan mentioned the advisory committee back in the 90s. They really focused, that advisory committee, on the fact that when you're talking about infants and toddlers and pregnant women, that you have to think about the family situations that those children and families find themselves in. So keep that piece in mind. However, when you hear about Early Head Start from the Act, so Early Head Start was added to the Head Start Act in 1995, there are a couple of things to keep in mind. So you have to provide early, continuous, intensive, comprehensive services that respond to the needs and the circumstances of the children and their families. You have to promote positive parent-child interactions, and you have to support the parents in their role as that child's first teacher. Okay, a couple of things there. So one of the other pieces that we often like to talk about is sort of the vision and the principles around this. And I give credit here to Joan and to Judy Gerald, who really worked on putting all these pieces together. But it is always an emphasis on high quality, where you are promoting healthy development and you're honoring the critical importance of early attachment. So again, it is the child and their family. This includes parent involvement. It includes inclusion strategies, and of course, one that we constantly talk about is cultural competence. So acknowledging that culture plays a huge role in how kids and their families are impacted, and the values and beliefs that families bring with them when they come into your programs. The other big piece here was around flexibility. So again, we're talking about infants and toddlers. It's critical that early Head Start programs have flexibility within their programs to support children and families through their development. And then, of course, transition planning. I'll talk about a little bit more about why the partnerships are so important in this piece. And then finally, collaboration. So to put it quite simply, Early Head Start is required to provide comprehensive services. The intent was never that Early Head Start do it all alone. The intent was that they go out and they find those community partners who help to bring all the pieces together. The Head Start performance standards. So if you haven't read them, that's okay. I have one right there that you can borrow. Hannah can hold it up for a minute. So just keep in mind that the Head Start performance standards, I often like to say, are sort of the Bible by which Head Start and Early Head Start programs run their programs. But the other piece I want to say quickly here is that the performance standards are just a floor. They're not a ceiling. It's just a floor. That's the minimum that you have to do. The expectation is really that you figure out, as teams, as partners, how to really make sure that you're providing quality services for the kids that you're serving. The other piece I want to mention here quickly is when you get a copy of these slides, you'll see that I put a little research note. So when Early Head Start was implemented in 1995, the federal government simultaneously launched a study on how Early Head Start would work, but they also launched a longitudinal study on Early Head Start. It still continues today. There are about 17 programs across the country that participate in the program. You can also always go up on the ECLKC to find that study, but there's a lot of really great information in there around best practices, what works, what doesn't work when we're talking about infants and toddlers. There are about 3,000 participants in 17 programs across the country. So here very quickly are the 11 service areas that Head Start and Early Head Start programs are responsible for. Again, keep in mind, it's just a floor. You can do more than this. And the other piece, I'm just gonna keep saying this again and again and again. Early Head Start is a community-based program. It's up to you to design your program. The performance standards are a guide, and they are a place for you to start to think about what is it that your program looks like through these partnerships. I'm going to keep echoing what Joan said, to be innovative and think outside the box as you move forward in this process. So here are all the eligible entities for Early Head Start grants. These are exactly the same for this $500 million under the Early Head Start Child Care Partnerships. So you'll see on there that there are a whole bunch, but I think that this was very intentional because the purpose was really to open it up to make sure that those entities that were, I guess, that had the best resources or had the best people to help out could really start to become part of the Early Head Start family. And again, this is about serving as many kids as you can in your community. So then let me go here quickly. So I'm going to start to kind of touch on some of the key things that you'll have to keep in mind as you put together your proposals. And I know Jeff is going to talk more about that, but these are some of the things that you don't get waivers on. So take notes. So as you think about eligibility, enrollment, recruitment, and attendance, keep in mind that as you think about this, up to 10% of your slots can be filled with high-need children above the poverty line. So traditionally, Early Head Start serves pregnant women and children birth through 2 whose income falls below the federal poverty guideline. We'll talk about the partnerships in a minute because there is a slight change. Children who are eligible for TANF or SSI or in the welfare system are also automatically eligible. At least 10% of the slots must be filled with children with diagnosed disabilities. Keep that in mind, that is a big one. And then just sort of as Hannah mentioned, once deemed eligible for Early Head Start, a child remains eligible for the duration of the program. This is Early Head Start only, not when they transition into Head Start. That is a very different thing. Early Head Start programs must actively recruit local families, and attendance must be monitored. So here's a critical piece. If the monthly average attendance for a center falls below 85%, it is up to the grantee to figure out why that is. There are times when you will have to submit plans to the federal government to talk about how you're making sure that children are attending those programs, whether it's center-based, family child care, whatever your model is. The other piece is that you have to always keep an active wait list, and you have to actively keep recruiting families. So as families move up and out, you already have that wait list ready to go. So here are the program options. So we've got home-based services, which basically means, everybody here knows what that means, right? Great, I'm not gonna go through those. Home-based services where somebody goes out to visit the family. Kids don't actually come to centers or are in any sort of organized care. Center-based services, which is a pretty typical model in which we find most of our Early Head Start kids in. Combination services, which could include both home and center-based. And then finally, family child care, which is in a private home or family friend and neighbor. The purpose of these multiple options is, again, maintaining that flexibility as you go with families and with their children through their development. So we do have programs who can sometimes change these options. I love that Joan brought up the Migrant Head Start program. Migrant Head Start programs constantly actually do change their model options depending on the age and the needs of their families. So you could see one program that literally starts with a huge infant, toddler, early Head Start program, and the next year, because the season has changed, are now suddenly serving preschoolers. Migrant programs have been doing this for decades, and it is a model that we see that it really does work. So I would encourage you, if you have, most of you do in this room, have a Migrant Head Start program in your state, go talk to them. Talk to them about how they do that every day. So a couple of things I want to point out about the partnerships, because this is a little unique and this is based on the appropriations law that we got. So for the partnerships, we know that there will be these options that will be available. So you'll have center-based, you'll still have family child care, and there'll be a combination of center and family child care that is available. But in addition, what changes here is that children are now eligible through 3. So this has always sort of been our no man's land in Early Head Start and Head Start. We've always had our 3s kind of just here, they're leaving early, there's not room in Head Start, where do they go? This sort of now helps to really solve this problem, which has been an issue for a while now. Oh, there's chatter. Write down your questions. Okay. I also would really encourage folks, I know there's not a lot of time, but to go back and read what you can on the Early Head Start study. Because part of what we know from the Early Head Start study is that a majority of the 17 programs who are in the study actually help families apply for subsidies. And many of those programs actually also keep supporting families when their eligibility ends. So what we learned through the EHS study was that Early Head Start grantees actually plan for when eligibility ends, and they actually, in some instances, end up making the copayment for families. So there are a lot of things happening, and I really encourage you to kind of have those broader questions with your programs. Okay, so here's the good stuff. Well, sort of. Take notes. All right, so ratios and group sizes. So this is pretty important. This is something that many of you will eventually get monitored, and it's a thing that you can see right away, right? You can see what the ratios look like. Again, this is all really based on the fact that research tells us, right? The smaller groups that we have, the more adults that are available, you make connections much easier and you have deeper connections with children and families. So our Early Head Start ratios for center-based programs require 1 teacher for every 4 infants and toddlers, and the maximum group size is 8 infants and toddlers with 2 teachers. You all know that there's a huge family engagement component here. Whenever possible, programs are absolutely encouraged to ask families to volunteer as a 3rd person in the classroom. As it relates to the family childcare option, the maximum group size for 1 teacher is 6 young children with no more than 2 under the age of 2. State licensing, if you're state licensed family childcare, also plays into this. So if you decide to do that model, which I would highly encourage, I would suggest that you really take a look at your state licensing requirements as well as the Early Head Start requirements to see which is higher, and then you go from there. Okay, so teacher and staff credentials. What's most important here for you all is the information, the 3 bullets to your right, which really talks about how center-based teachers must have a minimum of an infant-toddler CDA, family child care providers must have previous early child care experience, and child development consultants or specialists, which Early Head Start programs often employ, must have a BA or advanced degree. You can also look at the performance standards to get much more specific information on what the requirements are for consultants or specialists. The other piece to focus on here as you think about staff is that Early Head Start programs must provide pre-service and in-service training to all program staff and all volunteers in the program as it relates to health, safety, child development, early learning, and the other comprehensive services. And this is a piece that I kept pushing a lot, was all programs must have a professional development plan for their staff. Not like one that just sits in a drawer, but a real, live, living professional development plan. So 2 things to keep in mind. So as we sort of get into the service areas, this sort of just goes back to the purpose of Early Head Start, where we talk about primary caregiver, continuity of care, full year services. Some things that we really constantly stress with Early Head Start programs is ensuring that managers and other leadership in the program really have knowledge of infant-toddler care, and that they really sort of are the leaders in that program that understand those pieces. We also want to make sure that teachers are trained and qualified. Again, staff development plans. You also have to have supervisory systems in place to support staff, standardized screening and assessment, curriculum, continuity of care, planned, well-designed socializations if you're doing home-based, and a system of mental health support. This last piece, a system of mental health support, is really key as you think about infants and toddlers and their families. As Hannah mentioned, many of these families are low income. As Joan mentioned, some of them are living well below the poverty level. There are a tremendous amount of issues that come with families as they walk through the doors. So this is a piece that really has to be in place as you start to serve those families. There's also some requirements around nutrition. All programs are required to participate in the Child Adult Care Food Program. One thing I want to point out here is that each child must receive meals and snacks that provide between 1/3 and 2/3 of their daily nutritional needs, depending on the program. But this is Early Head Start, so they'll be with you all day, right? Okay. As you think about health, this is a big one. So I'm just going to point out a few things here because I'm hoping this will start to raise other questions for you that we can definitely continue to respond to and answer and provide more detailed information. Couple of things to keep in mind here is that within the first 90 days, the program must ensure that children have a source of health care, are up to date on all their primary and preventive health care, including medical, dental, and mental health. The other one is that within the first 45 days in the program, all children must receive culturally appropriate sensory, developmental, and behavioral screenings. And with that, depending on the information that you find, programs must have a plan to help support and address any issues or challenges that arise. And I'll also just very quickly state that as it relates to health, nutrition, and all of these other pieces, all these other service areas, programs must have written policies and procedures around how all of this is going to play itself out. So, Hannah mentioned that policies and processes are important. These go hand in hand when you think about your Early Head Start program. So I would highly encourage folks to think about what's happening with your state requirements, what do you got going on in Early Head Start, and figuring out sort of where the alignments are, where the intersections are, and what do we need to work on. As we think about family and community partnerships, this is a core piece. In Head Start, we call it parent involvement. We're now moving more towards talking about family engagement. If you have an opportunity, please visit the ECLKC, the Head Start website, and take a look at the parent, family, and community engagement framework. It really starts to lay out some ways that programs can start to think about a birth to 5 model and even thinking about some strategies as families transition into public school. So take a look at that. It provides some really great information. What we really just want to stress here is that, so 2 things actually, because somebody reminded me about this earlier. A lot of you may not realize this, but you have to have a policy council. Doesn't matter if you're a state, a university, a county government, community-based organization, for-profit, religious, you must have a policy council, and your governing board must include a parent. So just 2 really big things to keep in mind. And then the other piece I want to stress here is that as you think about family and community partnerships, one thing that is really a requirement for our Early Head Start programs is that they have to think about family partnerships in helping families to plan their goals and to think about how is the program going to support the family in reaching their goals. So one thing that I constantly complained about, and I hope everybody here does something different. So for many, many years, Head Start and Early Head Start programs do family partnership agreements, and it's literally one piece of paper. Some programs do this much better than others, but in general, this is what I've seen. And it's just basically a check, 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 check. What I really would like folks to think about is think about the process. So if your family set goals, what is the process by which you, the program, are supporting those families to reach those goals? And I'm just going to share this one story. It's a terrible story. The last thing that we really want to hear is that we have multi-generations of families coming back to early Head Start programs. That's not the point. The point is figure out your process to support families to reach their goals so they move up and out of early Head Start, okay? Okay, and here's kind of a big one. So you got to provide a 20% non-federal match. In general, this is not horrible. You can get a waiver for this, though, let me say that. And let me just say that the federal government, contrary to what you may often think, does really think about what is impacting programs. When I was at OHS, we did give plenty of waivers around the in-kind match, understanding what is happening in communities and especially what the economic impacts are in communities. But in general, this really is something that the program would have otherwise had to pay for. Right, so if you have somebody who's volunteering in there, who's providing mental health services that you would have otherwise had to pay for, that's in-kind. In-kind is not a parent telling the child to change the TV using the remote. Okay, that's not in-kind. Well, I've seen those before. You've seen those. Come on. And then the other big one I wanted to point out is that you cannot spend more than 15% of your total funds on admin functions. So keep those pieces in mind. And then facilities. Just a couple of things I want to point out about facilities is that if you're choosing to do a center-based option, is that your centers must have at least 35 square feet of usable indoor space. You must also have at least 75 square feet of usable outdoor play space per child. And for early Head Start programs, cribs have to be at least 3 feet apart, right? So keep those pieces in mind. Transportation is pretty straightforward. You're going to have to think about if families need that. I guess it's not so straightforward. Some folks are shaking their heads. But you'll have to think about really, though, and let me just say this. Transportation is not just about buying a bus and getting families bused to the centers. When I sort of think about transportation, it really is how are we supporting families to make sure that kids are attending early Head Start every day. So it may not be that you don't have buses, but if families have other issues that are impacting attendance, then that is something that the program really needs to think about, how they're going to support families. And again, that's where your community partners come into play. So please keep those pieces in mind. And then we already talked about this, but if you've got a migrant Head Start program, or even American Indian Alaska Native programs, there is a set aside in the $500 million specifically for organizations that will serve these populations. But again, both of these programs have been serving unique populations for more than 30 years. They do a lot of great stuff around culture and language and parent and family engagement, and also around building communities. So if you have those programs, please talk to them. They also are very good at flexibility, right? They've been doing a lot of that for many years. And I just have to end with this because for those of you who know me, so I started my life, my Head Start life, in a migrant Head Start program. And so we really had to deal with those issues every day. And one of my heroes is Cesar Chavez. And so as I was looking through my stuff, this came to mind about Cesar always talking about that policies are important, but it's really people who make the difference. And so with all of you here today, it really is true. People make the difference. And so I just thank you all for coming together. And I look forward to helping folks out, think through the details, and be innovative. Thanks, everybody. Thank you.
Okay, start getting your questions together. You will get a break, I promise. We'll move something else around. But I want you to take advantage of this time. So I think there are a couple mics out there if people have questions right away. There's Susan moving. But But let me start with this question, and then you should get your hand up. There are people out there to help us out with that. Look, Yvette, every state systems leader really, really wants the program you described. I don't think there's a state system leader who doesn't want to do screening in 45 days, who doesn't want programs to be developmentally appropriate and make sure there's comprehensive services. And we've talked about the amount of money. I had a state with 55,000 children on the wait list. So every time one moved off, I had to say, there's another family working that really needs that opportunity, as much as we did things around continuity. So the question to you is, what's your advice to state systems that have got to struggle with that? And Hannah, your part of that is, so how hard is it to change the policies? It really isn't a flip of the switch. I mean, there are child care administrators out here. We want to change them, but I read the regs again recently, and I've got to go to the legislature and get them to agree, and there's this public comment period, and lots of people have to think about and be involved in the decision. So, Yvette, what is your thoughts to state administrators that really want that for all of our children? And Hannah, it's a process. So what's your advice around that?
So my advice would be
Use your lapel mic.
Yeah.
I think they work, because that'll, it can be, I think. I think it can. There you go. No? Okay. Here, let's just do this.
So my advice to folks would be that, so you saw the eligibility requirements up there, but one thing, and this is getting into the weeds, but one thing is that within each program, you can also set your criteria by which you give families highest priority based on need. So what you saw up there is, again, it has to be families from low income or children from low income families, but within your program, you then can set the criteria for children who have the highest need as kids are successful and they roll out of your program.
So I think you're absolutely right. This is not easy. It's a lot easier for me to stand up here and talk about the policies than it is for you to change them in your states. On the other hand, it's a process, and so we have to start somewhere. CCDF has so much flexibility in it, and there's so many, many ways that we could improve the program that you could probably find a piece of it that would work in your state that you could get traction on. There are a number of aspects that don't, again, it varies state to state. In some states, you may need legislative action. In others, there are simple things to do that don't, that can be done through regulation that are pretty straightforward. And I just want to reiterate the last point that I made in the presentation, which is states and county governments are in a really tough place. They've lost so much personnel over the course of the last several years with the economic downturn. They haven't replaced them. So to the extent that you can make the case for how improving and simplifying the program helps agencies themselves and that they see a cost benefit in that, I think there's a lot of room to grow.
Do you have a question, Susan? Are you standing somewhere where there's a question? Is there a question? Okay, that's one right here. My friend from New Jersey.
Hi. I'm still struggling with the undocumented population. I'm still not clear. Can child care, for an example, Head Start serves undocumented families. It doesn't matter.
We don't say, we serve families are eligible due to income.
But those who are...
And we don't ask families what their citizenship status is.
Yeah, and I'll give you an example. In one of our Head Start programs, there was a sweep that came in and took the families, and the children were left in the programs. So, but with child care, do you pay for the families? Do you provide the child care funds for those families? I'm still struggling with that.
Whether they're
Do they have to have a Social Security number?
For subsidy?
Yes.
A Social Security number is not required for subsidies. If the state is requiring it, they must make it clear to parents that it's optional, and if they don't make that clear, we should talk offline.
But I think the answer to your question is if you find a child eligible for Head Start, I in subsidy can accept that eligibility. But if they come through subsidy first, I have to have a birth certificate. Other questions? Okay. Yep.
I have a quick question. As kind of a state administrator for subsidy, I agree with changing many of those policies to almost annual determination and making things more flexible for families. The real problem is there's not enough money. There's no new money from the federal government. With CCDF, states have been really pushed, and so that's where kind of the rubber meets the roads. We would love to be able to do all the things that Head Start does. There are some things that we can do with our policies, but unless more money comes, like through an initiative like this, which I think is wonderful because it's probably going to set the stage for blending and braiding and moving quality to a new level by moving money together, it's going to be really difficult to make the changes that are necessary, because policy changes without new money will either mean we serve less children or money comes with the policy changes, and that the federal government ponies up and does what they need to do and not put it totally on the backs of states. I wondered people's comments.
Well, I couldn't agree more that we need more federal money for childcare. We're working on it. Not that easy, but we were successful getting a lot of money for childcare in the last budget, so we're going to keep on moving forward. I think that, you're absolutely right. I acknowledge that childcare is in a really tough place, and a lot of these changes do cost money. On the other hand, we can continue serving more and more children, or we can serve the children who we're serving now better. And I think that those are tough decisions. Those are decisions that have to be made in individual states and individual communities in terms of what those policies look like. But I think this is a good opportunity to have those conversations.
Just one other comment. So in my work in Massachusetts, when I was changing policies, one way to do it is to hold harmless anybody who's in, so that your policies are going forward. So you slowly attrit, because I think Head Start over time served less kids over cost and not getting new money. So we can't have, as Ann says, access or quality. We got to have both of those things. Okay, Miriam.
We're looking at a model that would blend funding sources for children in childcare and early Head Start in the district. And our question is, are we allowed to set eligibility period at 3 years to match the early Head Start eligibility period for kids in subsidy? Yes.
Did you still have a question? Sherri?
Yes. Okay.
I'm having a little bit of difficulty.
Can you tell me who you are? Just so
I'm sorry. I'm Katie Chen from Hawaii, and I'm a director of a R&R agency, Patch, People Attentive to Children. I have a question, and I'm having difficulty grasp how some of these standards are going to apply in a family child care setting. For example, you have to have 10% of the children served must have disabilities. Now, if you're an FCC provider and you can only watch 6 children and maybe only half of them are early Head Start income eligible, and then,
So
you may not be able to have a child that's, how do you
Right.
meet those things with such a low numerical
So
threshold?
what's important to note here is that those requirements are at the grantee level. So let's say, for example, me, Yvette, Early Head Start, I decide to contract with Hannah Family Child Care, Yasmina, and Sherri Family Child Care. The 10% is on me. So it's the total
the
of what I...
composite of all
Right.
family
It's
child
the
care
total of
providers
what-
together.
So, yeah, exactly.
Okay.
Hi.
tell us who you are.
Okay. Hello. My name is Lily Irvin Vitella, and I'm the executive director of the Wisconsin Head Start Association. And in my previous life, I was the executive director of our Child Care Resource and Referral Network, so really can understand and appreciate the benefits to both of partnership. One of the needs that was identified by one of our existing grantees, along with child care providers in their community, is the need for more early Head Start supports for teen parents. Funding seems really tough because Child Care Development Block Grant money goes to the grandparents, not to the teenager, which at least in our state. And so that makes kind of responding to that need and doing what's really innovative tough. And so I think folks are prepared for doing the right thing in their communities, but we haven't had time really to get out ahead of some of the policy change we need to see.
So, I mean, just quickly, I would say that, again, we didn't cover everything we could on how much flexibility your state has, but the state decides whose income they're looking at, what income they're counting, who's a family, who lives in the house but their income is or isn't counted. So, issues with teen parents or the grandparents in that case, this is all state policy that you could think about. And CCDF also allows you to have, you could have different policies for particular groups. So just in the way that you prioritize populations, you could decide that, for children in partnerships, you are giving them longer eligibility periods than you're giving to all children in subsidy. Or you could just decide everybody could get annual eligibility. But you can do it in increments. And so that can help, I think, in some cases, move some of the state policy change forward.
Okay, right here, Susan, you can't, oh, no, there. Right behind you.
Thank you. I'm Janice Grundell from Connecticut. I have two A and B with regard to high need and target populations. I haven't heard the word child welfare except once on a slide which said protective services. And that's a connection that talk to Grace Whitney about, because in Connecticut they've done some great stuff. That's a way to pay for some of these services, especially since the child welfare substantiations are 90%, 80 to 90% in that awful category we call neglect. That's these families, very vulnerable families. The child welfare system can pay for things that fit beautifully into this if you get them to the table. So you might want to comment on that. The flip piece is the mental health system. There's a robust and really dramatically expanding literature about maternal depression. And if you wonder why attendance is low, we need to be looking at that piece of the system to assist the moms or whoever is the caregiving parent. That fits into this as well. Again, from the maybe braiding and blending, but certainly making sure that comprehensive means comprehensive.
No, I think that you make an excellent point, and so I just sort of go back to the piece around these are community-based, so we actually do leave it to, and I would say in this room, to these state teams to decide what those models look like. For early Head Start, children in the child welfare system are categorically eligible, so they are, and again, I guess I would suggest that folks visit the ECLKC. There's been a lot of work over the last decade between early Head Start and the child welfare system at the national level that has happened. There's a lot of information up there around best practices and how to get child welfare to really sort of pay for some of these other services.
Other questions? Talk to me about this attendance thing, because it's a real tension. If you do the campaign for grade level reading, let's just say, we are worried about attendance, and we know that the patterns that happen in infancy and toddler and preschool then carry into school. Low attendance, kids drop out. We've seen that research. In child care, we had a policy that said you can miss 10 days a month, and we would pay. And the problem with that was lots of kids miss 10 days a month, and when we added up the cost of letting kids miss that many days, because there really wasn't an incentive on the provider to do something about it because they were going to get paid. You say in Head Start, 85% on the program, and then they can write a plan so it doesn't hit the pocket immediately the way it does in child care. So what's the real philosophy behind the attendance thinking, either on the child care side or on the Head Start side?
I think Ken and I were just the philosophy is definitely the same for both, and all of you know the research that demonstrates that children and families have better outcomes when they attend on a more regular basis. So I think from the early Head Start and the federal side, so this does become a big deal in terms of when programs get monitored, when it comes to determinations around compliance, and that is just really It's one of the places where there's not a lot of room for waivers unless there's an act of God that happens. But in general, the Office of Head Start and the federal government takes this attendance piece very seriously. And while there is some flexibility in terms of allowing programs to put plans together, this can be one of the reasons why programs would ultimately get a deficiency, be found out of compliance, and be required to compete. So the majority of early Head Start and Head Start programs have 98% attendance rates in their programs.
And what's the churn rate? Kids coming through and moving?
So it's about, so we say for each slot, because we count in slots, it's about 1.2 kids per slot. So you're probably looking about 20% of turnover.
So, well, yeah, so on attendance though, I mean, states span the range from having 10 days is pretty generous. Many allow for far fewer absent days. This is an area in particular because of budget constraints that there has been a real step backwards over the last couple of years where attendance, paying for absent days is a place that states have made cuts. Again, understandably so, they don't have the resources. On the other hand, given what we know about the importance of continuity for kids, I think, again, this is an area to have a philosophical discussion about the importance of supporting children in their childcare settings, but as well as supporting providers and, maybe taking this idea that's from Early Head Start of thinking about how providers can also help families with issues that are keeping them from getting to childcare, but making sure that kids are also getting to those settings as well. There is no, policy that requires you to to reimburse providers, to pay for only days when kids are there, only the hours. So you could move to an attendance-based system.
I'm Diana Bender from Seattle, Washington. I'm super in favor of attendance, and I get the attendance data. But I think when you look at transition, as a former childcare provider for many years, when you look at moving to a full-day model, I know many of the Head Start families who are in the immigrant refugee community, which is a very big population for us in Seattle, they need to go home for a month. If their family's going to make the big investment to go back to their home country, they're not going to do it for 2 weeks. And so in a full day model, a family might go away for a month, but they might do it in the summer if they're at Head Start. And so when you're looking at a full year model in an early Head Start childcare partnership, how do you recommend adjusting or supporting that so that we are actually honoring and being culturally competent for those families, and also meeting that? I mean, you just can't meet 85% if you're going to have kids gone for a month, right? And or for celebrations like Eid and that sort of thing.
Right.
So, thank you.
Sure, thank you. So I would suggest talking to your migrant Head Start programs. So to be quite honest with you on this piece, it is a certain number of days that children have to be in the program. And so one thing that we know from our migrant Head Start programs is they tend to run all year except in the sort of December, January, when we have our immigrant families who leave to go back to their native country for a month to 2 months. So it is possible. The requirement is that you meet, and I apologize, but I've totally lost the number of days that are required. Do you remember? You don't remember? Okay. I will find it. But all you have to do is meet the total number of days. You can run your program wherever you want. You can run it from January to March. You can run it from summer. You can. So it really just depends on that.
Yeah, so I hate to push on this, but I really want to just be in the reality is that if you're serving in an immigrant refugee community and you have a variety of immigrant and refugees in your program, so in one class.
So I have an answer for that too.
Yeah.
So
'cause it's not the same.
one other piece that is allowed in the Head Start law is what we call a locally designed option. And so basically what happens there, and we have very few programs who take advantage of this. But what happens there is a program, for example, like in Seattle, you would come in and say, so this is the families we're going to serve because they are the highest need, but here's the situation and here's our model. The federal government does have the authority to approve your locally designed options. They will, however, though, then sort of say to you, then this is what we're going to monitor you on based on this model.
Sherri, we have one over here.
Hi, I'm Louise Stoney, and I've had the privilege of working with many of the people in this room on quality rating and improvement systems. Most states have done this, and in the course of the work that I've done, states have learned a couple of things that are really important. One of them is that they need to be flexible in terms of how they define quality so that they can honor the culture of many different programs, that there are lots of different pathways to quality. And the other thing I'm seeing states learn is the need to, what I call the few and the powerful, have fewer standards that are more powerful. So this is the experience that states are living in with QRIS, and now we're working on partnerships with Head Start standards that don't appear to have very much flexibility and don't certainly appear to be few and powerful. So I'm curious about how we put those two things together.
So, okay, now we're getting to it. So I guess I would say to you from the perspective of somebody who has been in a program but who also then had to run the program, I would say that I do, from my perspective, while there are a lot of standards, and it can range anywhere from 200 to 1,700, however you want to count them, they really, again, it's sort of it's just the floor, right? It's like the minimum of the kids should brush their teeth. They should brush their teeth. There are some places, like toothbrushing, that's a terrible example, where it does say how you want kids to brush their teeth. But let me say this. Writing regs for those who have been in the federal, or even I'm sure it's the same in state government, is a very laborious process. The amount of scrutiny that comes from that is truly amazing. And while the federal government has been working on trying to revise these regulations so that they are more friendly to partnerships with states and with childcare, I'm just going to share one story, and the Head Start people are probably going to be mad at me. But the thing here is that often when we've tried to revise these regulations, because we have Head Start programs who don't like them either, right? They think they're burdensome too, and I agree. And we say, all right, so take it and red mark what you would take out. And nobody wants to do that. And so for me, as I'm sitting here, one thing that hopefully could come from these partnerships is that maybe this is another opportunity to think about really how can we take some of these standards to better support what's happening in states to make it easier for early Head Start grantees to partner with local childcare. But the thing that we won't give in on is maintaining that quality that we've had in early Head Start. I would also, though, agree with you. I think in Head Start, there is flexibility and there are different pathways to quality. And it is all around, it's all based around the needs of the children and families. And if programs come in and say, you know, I know it says that I need to brush kids' teeth like this, but that doesn't work for the people I serve, you know, that's okay. It's just that we want programs to be able to demonstrate and justify why they want to do something different. But the bottom line is that kids need to brush their teeth. I don't know if that helps.
So just a quick anecdote. I was with a group of pediatric ophthalmologists last week, and they were telling me all the way that people are screening for vision that are not proper, and they wanted us to have a standard about it. And I said, I don't think that that's going to happen. But they were really.
Somebody else doesn't like that idea. So in closing, we're gonna wrap up, and you're gonna get your 15 minutes. But I want each of you to say it's back on. I want each of you to say what's one thing we have in common, right? So let's start with Yasmina and then go to Hannah and Yvette. Tell us something that we actually do have in common.
I think the children and the families, that's the first thing that we have in common. I think we all, right? We all have I'm pretty sure, commitment to quality, and then the commitment to serve as many of those children as we can. And I think that's where I see the great hope for the partnerships, because its goals are tied around, increased access to quality for those children and the families.
It's going to be really hard.
Ditto. No. So I mean, I do. She named it. I mean, those are the common threads and the common approach. I think what's great about the partnership, and I think, because this was said earlier, I think it was Joan that said it, is that this is about meeting the needs of low-income working families and their children, and that has not necessarily been done always through Early Head Start. And childcare, while it is about meeting the needs of working families and does have a commitment to quality and is moving in that direction, has a bit farther to go on the quality. And so being able to put the quality together with those working families to support their needs, I think is, a common place.
That's okay. I'm going to say that aside from these, hefty performance standards, I will say that I think that there is flexibility in the pathways to quality.
Thank you.